Well, despite months of coronavirus restrictions, tonight local health officials are concerned about a rise in sexually transmitted infections. I spoke today with the Director of Community Health for Desert AIDS Project, CJ Topi. CJ, thanks for joining us.
Thank you for having me.
So let me start by asking you, what is happening right now in our community that is creating more sexually transmitted infections?
Yeah, so the entire globe, specifically the Coachella Valley, has been concentrating on the coronavirus right now, known as COVID-19. And so a lot of experts and a lot of services have kind of taken their eye off of HIV and STIs.
So what specifically do you think is leading to this spike?
So there's a couple of different reasons that are leading to the spike. Obviously, people have stay-at-home orders, but they're not abiding by them. So we learned through the AIDS epidemic that even though having sexual intercourse with people is going to lead to HIV infections and STI infections if proper precautions are not taken, that people are still actively engaging in sexual behavior during stay-at-home orders. That's one. Another is also that a lot of medical facilities have moved to virtual visits, which means they can go meet with their medical doctor from their own home. This then leads to not following through with being tested then for STIs and HIV on a routine basis.
I was just about to ask you, are you seeing a reluctance from people who are not going to get tested because they don't want to come in contact with coronavirus potentially?
Yes, in March and April, we saw a decrease in STI testing and HIV testing. Now that the stay-at-home orders were reduced and now they're back in full force again, people did come in and get tested, and that's where we saw a big increase in syphilis, HIV, and also chlamydia infections.
Put this in perspective for us. When was the last time you saw this type of a spike with these infections?
So right now with syphilis and chlamydia, we're trending at a 20% higher rate than all of calendar year 2019. I know about a year ago, there was a release by the county health department and also CDC that Riverside County, specifically Coachella Valley, was kind of a hotspot for STI increases. Currently, through the first 6 months of 2020, we're seeing a trend that's even higher than the previous year.
20% higher compared to last year. How concerning is that for you?
So it is a concern. The thing is we're going to continue to look at alternative strategies to prevent HIV and STI infections. For HIV, there is PrEP. There's pre-exposure prophylaxis. It's one pill a day that people who are HIV negative can take to remain HIV negative. As far as STI infections, routine testing every 3 months based on your sexual partner history. And then also, I can say that at DAP, a lot of people are hesitant to come in and get frequent testing because of COVID-19. And so most of our medical visits are now virtual, which means that our patient volume in our clinics are very low. So people can come in and get an HIV test or STI testing at our clinic, and the COVID-19 exposure will still be low because the patient volume has decreased. Also, we're screening people at our doors as well. So we're screening to see if anybody's had COVID-19 symptoms. We're doing temperature checks. So we're making sure that our staff and then obviously our community and our patients that enter our building are safe to come in and do testing.
Is there a certain type of demographic that you're seeing become infected?
Well, this is Palm Springs, so older gay white men is always a leading facet of that. However, we do still see an increase in Latino men who are having sex with men or possibly on the down low. Those would be the two demographics right now that we see an increase in.
What is the main message, CJ, that you want the community to hear right now?
Well, the main message, obviously, we need to continue to live our lives and follow CDC recommendations when it comes to the coronavirus. But also just know that your sexual health and your medical care in your body is still significantly important. So call our number, which is the doc, which is 760-992-0492. We're open 8 to 5. It's Monday through Friday. It's $25 for STI testing. HIV testing is free. So come in and see us, and we will take care of you. I recommend routinely testing and being in direct contact with your doctor.
All right, CJ, we appreciate your time. Thanks for joining us.
Thank you for having me. Take care.